Good morning, good afternoon, good evening, wherever you may be joining us from. So my name is Sabine Nkusi. I am the Gender and Protection Lead at TFund, and myself and my colleague Uwezo Lele, who is the Transforming Masculinity Advisor, will be making the presentation on TFund behalf today, and will be presenting on Transforming Masculinities. So I would like to start to give a little bit of a background to TFund SGBV work and how this work started. So our work really builds on the work that we have done on HIV and AIDS, which very much worked with the faith communities. And this work started in 2010 with formative research in various countries. So we had countries such as Rwanda, Burundi, and DRC, where we were looking at the role of faith the potential role of faith in addressing the issues around rape, especially in places where there has been a conflict. And as we were doing that formative research, we heard from survivors, and survivors were very adamant in that they were not being heard, that there was a silence around sexual violence or the rape they had suffered, that there was stigma, that they were facing a lot of stigma. It was not just in the community, but very much so in their churches as well. So with that, what was also interesting is that they were really keen for men and boys to be part of this conversation, that in order for us to have a solution to this issue, to this pandemic really, that they would need men and boys to also be part of that conversation. So we listened, and we took all of that on board, and our work on SGBV thus started. And it really it focuses on prevention and response to sexual and gender-based violence, and looking at other forms of violence against women as well. We work on female genital mutilation or cutting, and also early and child marriage. Our aim is to work towards gender justice, so exploring the intersection of men, faith, and masculinity. How does that work? What does that mean? And our work also covers a diverse geographical and contextual focus. And later on, my colleague Uwezo will share some of the specific countries where we have been working and doing this work. So what is Transforming Masculinities, or what we call TM? So the Transforming Masculinities approach is a community mobilization process, sort of a community activist approach within faith communities. For us, sexual and gender-based violence is the entry point, but the goal really is to promote gender equality and positive masculinities. It is about personal commitment, willingness to change, and reflective process for all the actors who are involved. And this is really key to the success of this process. And it is a facilitated dialogue with selected men and women, and also has a focus on diffusion activities in wider communities. The aim is to change behavior and challenge harmful social norms, and reinforce positive gender norms through role models. It focuses very much on gender equality, gender norms and roles. It looks at power imbalances. It looks at relationships through scriptural and critical self-reflection and interactive activities. And because of the nature of SGBV as well, we look at accountable practices because of issues of power, privilege, and also impunity that we have seen across the work that we do. So why Transforming Masculinities? So as I said earlier, our formative research and listening to the voices of survivors, they're really clear that they needed to engage men and boys. We needed to engage men and boys meaningfully so that they'll be part of the solution. And we know that in terms of violence against women, the majority of perpetrators are men. So it was important for us to engage men and boys also from a young age for a meaningful change. They also need to challenge harmful interpretation and application of scriptures. So we have seen in the work that we do, especially working in faith communities, how scriptures are very much misinterpreted, and that can lead to violence. So for us, Transforming Masculinity is about challenging some of those harmful interpretation and also application of scriptures, and to also support the behaviors and norms change. Transforming Masculinities also look at promoting an alternative model. So what is the alternative? If we have in our society such behaviors, such toxic masculinities, what is the alternative model? And it's also about having a much narrative about gender. And it's about also the need to engage with men and women holistically. So we're not saying that this process is only for men, but it's actually for both men and women in the community, so that they both engage in the process, and to also engage religious leaders and communities. So gender inequality and equal power and accountable practices are key parts or key pillars of this gender transformative approach. So we tackle those issues. We look at power issues and accountable practices. And we've come to know in places where we work that faith leaders have such influence in terms of the behaviors, in terms of beliefs that the community have. So they can very much become catalysts in shifting social norms. So that's one of the reasons why we very much work with faith leaders and faith communities. And some of the key parts or key features of TM. So as I mentioned earlier, it's scripture-based reflection, dialogue on sexual and gender-based violence. And the sessions are framed around key scriptures that influence norms and practices. And it's a group learning and a safe space for dialogue for both men and women. And it's very much an experiential learning, and it's interactive with practical activities, and it is also a very safe space. And it brings discussions on gender, masculinity, sexual and gender-based violence within the context of people's faith and culture. And it also promotes accountable practices at all levels. So it is not about just the people at community level that who need to be accountable, but it's also the leaders, so the pastors, the imams, the religious leaders at every level. It promotes accountable practices. And it aims to address underlying beliefs, norms on gender, gender inequality, and harmful practices. So I'll now pass over to my colleague Uwezo to talk about the main component of Transforming Masculinities. Thank you.
Thank you. Transforming Masculinity approach has three main components: faith leaders component, gender champions, and community leaders. All of them need to be trained, and faith leaders need to be trained at different level so they can engage and support the process. And this, during the training, during the workshop, they are equipped to provide a good leadership and support for the transmasculinity process. Gender champions are also trained, but before being trained, they are selected by community faith leaders. And these community faith leaders select key male and female members of the community to go through the process, to be trained as also facilitator of a small group we named community dialogues. The community dialogues are the small groups of men and women who will be meeting every week in their communities for 6 weeks. And these discussions will be led by those we called gender champions. And these people will be meeting for 6 weeks, as I said. And from the 1st to the 5th week, they are meeting in single-sex group, means men are meeting in one group and women in another group separately. And the last session, the last week, they are coming together in a combined sex group. So the community dialogues are led by gender champions, are facilitated by gender champions for 2 hours maximum per session, and this for 6 weeks standard. This is a standard model because we have adapted the Transforming Masculinity to other area of work, and according to this adaptation, there were need to have more sessions than 6. But the standard one has 6 weeks, 6 sessions, as it's presented here. And the minimum of participants is 8 men, 8 women, and the maximum is 10 men, 10 women. So as you know, as you can see here on the image, participants are in single-sex group from the 1st week to the 5th one. And the last one, the 6th one, they are meeting in the combined group. Male only sessions are led by male gender champion, and female only sessions are led by female gender champions. According to the importance of the process, it's fine to keep to inform participants during the recruitment that they could attend, all the different sessions, so can see the change according to the different topics as they are structured. So we have seen that from our experience, we have seen that 80% of participants attended all these different sessions. So it's important to inform them at the beginning that as we are starting the process, as you are committed to attend the first session, please go till the end. And the accountability for participants is also key during the process. You need to be more accountable to each other, participants, even at community level, especially for those who are playing a role for this program. We have different topics developed during the trainings, during community dialogues. You can see the first week we talk about introduction to SGBV and root causes. Here we are helping people to understand why should we address SGBV. Is it a matter, is it a problem to our context? And we are contextualizing this, helping them to know what is happening in their community. And from there, we'll develop also about, we'll give them a knowledge of what is SGBV and what are the consequences of SGBV, the contributing factors, and also the root causes of it, and how we can, start doing things addressing this. Part of that, after this, we'll talk about second week, we talk about gender roles and norms in daily life. This is also something we contextualize in their relationship in terms of how gender or roles or norms are made between between men and women, how they are living this relationship when it comes norms and roles into their relationship. The third week, it's about power, status, and SGBV. SGBV is a dynamic power matter. So people need to understand better how, when we have different power, how can we use power without, harming someone? And the status itself, it can bring you power. You have different status. You are a father, you are a mother, you are the boss. Maybe it's giving you more power according to your status. So you need to understand, even if I'm a boss, even if I'm a father, I'm a man, I'm the chief of the house, I'm a chief of the women. How should I use this power given to me without harming the person? And this is helping them to understand the good way of using power, the good way of acting, of how we can build our relationship. The week fourth is about faith and SGBV. Also, faith is important in our relationship, as we are believing to something, to someone, or to God. We need to think, to know what is our faith, what the freeways our faith can have, so SGBV can't happen. And moving forward and reflection, it's something, we are reflecting on what we went through and how we can change, what can be changed from what we have been, evolved in. And from there, now you can take the decision of moving forward. And last week, which is in combined sex group, is where we'll be looking ahead, envisaging a community free of SGBV. So, as I said before, male-only sessions are led by male gender champions, and female-only sessions are led by female gender champions. We have three main tools we are referring to, and this is the standard model, because according to the adaptation made, there are other new tools, other new module we added to this according to what the specific domain we adapted. So here I'm presenting just the standard TM model tools we used. And you can see here the Transforming Masculinity tool, which is the main training tool for all gender champions, faith leaders, community leaders, and other people. From there, then we have this guide, which is a community dialogue guide, and this is for gender champions, which is helping gender champions to lead or to conduct the community dialogue happening at community level. And we have a hand in hand, which is a biblical studies to transform the response to sexual violence. We have some scripture, some references here, which will help faith leaders, which can help gender champions to address some issues according to the faith you work in. So we have adapted TM, the Transforming Masculinity to What Works project. This was done in a post-conflict settings and in a rural area. Also, the Transforming Masculinity was adapted to women economic empowerment integration. This was done in Central African Republic. And we adapted the Transforming Masculinity to the masculinity, to the family planning, and we called the project Masculinity, Family and Faith, as we put in, this family aspect, family planning, and what is the place of the faith in all this masculinity, in family and planning. And the same TM was adapted in Nigeria to the family and peace, and we called this project Masculinity, Family and Peace. But here in this adaptation, we added the family planning and social cohesion, as we had to work with Muslim and Christian, according to their faith. There are some tensions between people according to their faith. So we helped them we were discussing about how they can work together. And we have adapted this to FGM, female genital mutilation and cutting, and early child marriage. This was done, the adaptation was done in Sierra Leone, Chad, and Mali. Conflict affected in humanitarian context, Iraq, Pilot, and DRA, and also Central Asia on non-faith focus. Here we were not focusing on faith leaders, but we tried to use other leaders, other community leaders, not only faith. The church mobilization integration, we tried to integrate this in the church mobilization approach, so they can, when they are mobilizing, church is mobilizing their members relating to other issues, they can bring in the TM component. Also, the Livingstone, this was done in Jordan and with Syrian and Iraq refugees. And the other adaptation we are working on for now, it's for education. This is in South Sudan. We are trying to learn why girls are dropped out from schools, and we want to TM to contribute to this so girls can continue their school without dropped out. According to the main problem we have seen, there is some beliefs, there is some early marriage is also among early child marriage is also among the main contributing factors which are letting girls to go out of school. OTM has been implemented. We have implemented this in Colombia, Brazil, Central America, and we have implemented this in DRC, Democratic Republic of Congo, Burundi, Central African Republic, South Sudan, Rwanda, in Chad, Mali, Sierra Leone, Liberia, and Nigeria, in Myanmar, Central Asian states, Nepal, but also in Jordan and Iraq. This is very, very important for you to know why TM, why we are just presenting where TM have been implemented, because we think it's fine to consider that TM is adapted to different contexts, and this adaptation, we are not doing the same thing in the different areas. So when we come in the community, in a country, for example, we need to adapt it to the local context, and this is very important, the adaptation. So I'm going to share some findings from one project we implemented in DRC, where it was under the World Works Consortium. It was funded by UKAID, but the research was led by the Stellenbosch University for South Africa. So the project was titled Engaging with Faith Groups to Prevent Violence Against Women and Girls in Conflict-Affected Communities in Eastern DRC. So here we saw different outcomes, and the result was very encouraging in terms of social findings, the shifting of findings. You can see from violence to non-violence response. For example, among men, self-reported perpetration reduced from 68 to 24. And among women, reporting intimate partner violence reduced from 69 to 29. From male superiority to gender equality, men have developed alternative patterns of masculinity. This is a very good example or very good output, as men understood that there is another way of being a man. Masculinity is not just being harmful. We need to find a good way of being a man. Belief that men are superior to women has dropped from 90% to 70%. This is also important. And women's attitude that their primary role is to care or to cook for family reduced from 90% to 75%. And you can see here that women also understood that it's fine maybe to consider ourselves, to value ourselves, not just to what we are able to do, but also according to how we are created, not according to our gender, our sex. No, we need to, not according to the different role we are bringing to the community. We need to be valuable at the same level, as men. From tolerance to resilience, a number of attitude to IPV reversed. You can see here, for example, belief that women aren't allowed to refuse sex dropped from 80% to 55% among men, and women's belief that disobedience of wives justifies violence dropped from 53% to 38%. From stigma to support for survivors, we found that there were survivor internal stigma reduced, as did external stigmatizing attitude. There were reduced of internal stigma, but also external stigma attitude, and the significant reduction in rape myth beliefs among men. By end-line, 40% of intimate partner survivors sought assistance from faith leaders, and increased from 2 At the beginning, there were 2% among survivors saying that maybe we can go and reach out to faith leaders for support. But at the end, it comes from this level from 2 to 40%, which is a good shifting in terms of how faith leaders could be considered as people giving support to survivors. And 74% of online respondents felt their faith institutions supported survivors. The way people or community members were seeing how faith leaders were active, talking against SGBV, they found faith space, faith community, faith institutions are supporting survivors at 74%. From silent witnesses to vocal champions, faith leaders were seeing things happen at community level. Now they are talking against, they are speaking out. So it is something good to see how faith leaders are effective change agents and have become primary group approached by survivor for support. So 83% of all respondents attended a public talk or discussion related to violence against women and girls by online. This is something good also, seeing that how 83% of community members attended at least one talk against or discussion related to violence against women and girls. And 64% of respondents at online had accessed couple counseling mainly through faith leaders. These faith leaders were equipped in terms of giving support to people who need support, counseling support. We have core principles to consider for masculinity. We are challenging harmful social norms and gender norms. When we found gender norms which are contributing to gender inequality, power hierarchy as root causes, we are there to challenge all this so we can promote alternatives way of gender, of how power can be used, of how norms can be made. And it's a community mobilization process which is well structured and led interventions model. As you have seen, we have different sessions. We need to follow how they are structured so the people can learn according to the way the sessions are developed. And we want community members to take on the leadership of these activities, to lead on these activities, because we want to make them their own activities so they can contribute to attend or to achieve good results at the end. And we want also to go through a learning and a practical move away from theoretical discussions. We are not just discussing theoretical things, we are contextualizing this, and people attending this can make a big change according to what they are see happening in their community. It's also an interfaith approach which is bringing different faith community together, and during this meetings, it's promoting a kind of social cohesion between them and working in a collaboration where needed and appropriate. Gender equality, addressing root causes, and framing of SGBV as an outcome of gender inequality and reference information. Accountability is also important, both at personal level but also at relation level. We need people to be accountable to each other, but also accountable to themselves. To themselves, they need to get some knowledge about how to avoid SGBV to happen. So people can, before doing something, they can think about the consequences of their act. So this will make them accountable at personal level. At relation level, it's where they will be interacting with other people to make sure that when I'm doing this, someone else could not be harmed by my act. And it's a learning and adaptation. This is also important. We are not doing the same thing in different contexts. We need to adapt this in different contexts where we are moving for. And it's a continuous learning and feedback loop programs for program actors. This is also important. Those who are involved in this program need to be ready for learning, to get feedback, to receive feedback of how to improve the process, the approach at community level. Thank you very much for your listening.